hear me talk a lot about the DMOS Orthopaedic Centers. And just ironically, we've been talking a lot about the foot and ankle team at DMOS Orthopaedic Centers. Well, ankles are definitely in the news as Brendan Sullivan, the Iowa quarterback, is going to miss the Maryland game, most likely the Nebraska game, which is believed because of an ankle. Now, Coach Kirk Ferentz said yesterday that there's no break, but he's going to need some time off. So we go to the experts. We go to the guys who are really smart. We go to doctors. And joining us now on the Morning Rush is Dr. Jason Sullivan from the DMOS Orthopaedic Centers. How you doing, Doc?
I'm doing fantastic. Thanks for having me. How are you today?
I'm doing great. It's morning time. I'm always at my best in the morning. So it's going well. I can walk straight and without a limp. So that's good. So
that's good for most of us, no doubt.
Yeah, no kidding. So when you've worked with athletes for a long time. So when you hear no break, but you're out a week, maybe 2 weeks, what does that sound like to you when it comes to the ankle?
Yeah, I mean, to me, that means there's some type of ankle sprain, right? So when we refer to ankle sprain, we're referring to ligaments around the ankle that stabilize those two bones. So the tibia is kind of the bigger of the two bones around the ankle joint, and then the fibula is a smaller, thinner one that comes down around the outside of your ankle. So those two bones are held to the crux of your ankle by a bunch of different ligaments and held together by some ligaments as well. So, my suspicion is it's either a really bad lower or lateral ankle sprain, or it could be in the class of like what we call a high ankle sprain, which is a little more rare, but also a little more disabling in terms of mobility. And so it makes sense that it's probably in one of those two categories, maybe even favoring somewhat of a high ankle sprain because it's going to take more than 2 weeks, it sounds like, to get better.
So I've always heard this. You tell me if I'm wrong, because, I get on the WebMD and I think I'm a doctor, which I'm not. But I hear that high ankle sprains are almost as more painful and worse than a break. Is that true?
Yeah, I think ankle sprains in general. Yeah, I mean, have you ever sprained your ankle? No?
I'm sure I have, but not what I'd call anything seriously.
So the first time you sprain your ankle, it's a pretty significant event. And if it's traumatic enough, the swelling that takes place and the just putting weight down for a couple days is really, really painful. The more times you sprain your ankle, usually the quicker you'll recover that second, third, and fourth time it happens. But the first time, it can be quite an event. And a high ankle sprain, it almost makes you feel like the two bones aren't together, where essentially you're walking on a leg that there's no stability. So your ability to not just walk straight, but actually change direction is significantly impacted. So for a sport like football, where you're trying to avoid 300-pound guys coming at you, trying to tackle you, I mean, it can be quite a thing to recover from. So,
we talk about recovery time, and let's say we know he's going to miss this week, possibly next week. What's a true time you could come back and really be 100% from a high ankle sprain, or even a really severe lower ankle sprain?
Severe lower ankle sprain, a couple weeks, 2 to 4 weeks. I think a high ankle sprain that's severe, you're looking more like probably in the 4 to 6 week category. So to me, my guess is, he's going to probably be out the rest of the season. If he plays against Nebraska, it'll be more in a, game manager kind of stay in the pocket category. They would really have to tape him up pretty well for him to be super mobile. But it looks like maybe leaning towards more, being eligible for a bowl game. And usually by the bowl game, things are feeling a lot better. Mobility gets better. Swelling calms down. But as you can imagine, first you got to get the swelling down, and then you can actually work on being functional again. And if it takes a few weeks for that to happen, you lose a little bit. And so you got to build that strength up again.
So how much swelling are we talking about? Are we talking this thing's like deep purple?
Oh yeah. I mean, it can definitely be the case. I mean, the entire, it can swell from the ankle all the way down through the foot. I mean, it can be very substantial in some cases.
You asked me if I've ever sprained my ankle, and I'm starting to think I never have, because twisting an ankle and being sore for a day or two is not an ankle sprain, is it?
I mean, you might have had a very subtle one, but like you really know it like in hoops, if you come down and you land on someone's foot, and you really know it, because that ankle within 10 to 15 minutes is sometimes twice the size of what it used to be, and you can't get around on it.
Yeah, you're making me feel like a wuss, because now I know I've never sprained an ankle.
Go play some pickup hoops at the gym. See what happens.
Because I'm 54 years old. If I go play pickup hoops at the gym, I'm going to rupture an Achilles, or I'm going to tear an ACL, or I'm going to sprain an ankle. And I don't want to do that anymore. I'm too old for that.
Honestly, that's why I stopped playing hoops, because I started taking care of friends that I played high school at basketball and pickup basketball with. So you start looking around, you're like, those guys are better than me back in the day. What am I doing here? So it's an aggressive sport.
You're coming off the high school football season. Did you guys see a lot more knee injuries, ankle injuries? What did you see the majority of this year?
It's a good question. It's a lot more. You see a lot more ankles, but there was a fair share of knee injuries this year. And, for whatever reason, it seems like it happens to, in many cases, a lot of the more high end athletes. I don't know if it has something to do with their ability to get in spaces that most people can't, or cut a certain way. But, those knee injuries can be pretty devastating when you tear a meniscus or an ACL and things like that. So, we see a lot of that. We see a lot of clavicle fractures, to be honest with you. There's a lot of concussions out there, unfortunately. But yeah, I mean, it's mostly lower extremity stuff. I'd say shoulder dislocations, though, you throw that in there. I mean, if you cover a sideline, you're going to see a shoulder dislocation throughout the fall. So those happen quite frequently as well.
You brought up concussion, and Cade McNamara has missed the last 2 games with a concussion. And Kirk Ferentz said yesterday that he wouldn't even be the starter, even though he's been cleared to play. Probably wouldn't be the starter. I mean, I look at Tua Tagovailoa, excuse me, as I got something in my throat. But how fast can you come back from a concussion, and does it just go on the severity of it?
Yeah, I mean, severity is a big deal. There are doctors that strictly specialize in concussion these days, and ultimately every athlete has a baseline cognitive test, and then you can, as things go by, you can test them for their symptoms and then also compare them to their baseline. So things are so detailed now. If someone has a concussion on Sunday, the chances of them playing the following Sunday seem to be getting slimmer and slimmer, because we know these subclinical symptoms that we used to think, oh, you're fine. They want those completely cleared up now. So it almost seems like it's a 10 to 14 day thing until a patient or an athlete's ready to go back out. I mean, it's sometimes longer.
Excellent stuff. Dr. Sullivan, always appreciate you taking the time. And, of course, if you want to visit with Dr. Sullivan, if you get injured, go to DMOS.com. That's DMOS.com, DMOS.com for all your orthopedic needs. Doc, thanks for the time. We always appreciate it.
You got it. Thanks for having me.